Innovarius Therapeutics presents a case study. Meira, Ivdd. Hi, my name is Dr. Al Nunez. I'm a research scientist for Innovarius LLC. I'd like to talk about an interesting case that we had recently. Meira was a little dog that came, or is a little dog that came from the Northeast down to Florida for treatment for intervertebral disc disease. She has some herniated disc in her back, right around where dachshunds always get them. And we use the Sonowave device, which uses radiofrequency energy as an electronic anti-inflammatory for neurologic disease, and as a way to accelerate wound healing, in this case for spinal cords, and provides a non-invasive, non-surgical alternative in many cases to dogs with the typical back injuries that we see so much in clinical medicine. I hope you enjoy the video and you can see how quickly she responds. Something I'd like to point out is many of these dogs are responding within 1 to 3 to 4 weeks with the intervertebral disc disease condition, and seem to respond really quickly. Meira was standing after 1 week, a little sloppy, they usually do, and then she improved as over a course of 2 to 3 weeks. We'll show 2 videos. Which one is her intake. Realize that we did about a treatment a week. She was flying in from the Northeast and from Georgia, and we did that for about 3 weeks, and it shows you how rapid her neurologic recovery was using the Sonowave device. Thanks for watching. Okay, and I got Meira. She's 10 years old, and how many weeks ago did she go down? About a month ago?
No, a week ago Friday.
A week ago Friday, she went down. She jumped off a couch, and then kind of as she got to the door, got more and more pain, it seems like, and was screaming out. Is that right?
Yeah.
Anywhere she was touched, she was screaming out. She's been standard level of care. She's had tramadol, prednisone. She's on a couple of Chinese herbs now, double P number 2. She's on cervical formula or something like it, Digupisan. So she's had a few rounds of anti-inflammatories. I think Rimadyll's been on there. So she's on the standard, well, not Rimadyll, prednisone and tramadol and methylcarbamol. That's what I'm missing. So that's her drug mix. She's also had electroacupuncture. She's a little better, but she's coming in for some Sonowave, see if we can get her a little bit more up from this stage. So when we do her neuro exam, she's kind of recumbent. She does have the ability to stand a little bit if you help her. She wants to be lying down, as you see. And I'm going to try to get her up, and you're going to see her front legs on neuro are weaker. There's a lack of a righting reflex on the right. So there's a lack of a righting reflex there. And let's do on the left. We also have a righting reflex on the left. She's able to, maybe it's diminished for sure, but she maybe has it a little bit better on the right than on the left and on the right. Yeah, not able to write there, okay. Back legs, diminished but there, diminished but there. Lack of proprioception, for sure. She's dragging on the right. And we have a drag on the left. I have a hop on the back. We're going to do a proprioceptive, see if she can right herself. That foot can. This foot, no, got a drag. So again, she can place with the one. This one drags. These two can place. So we're thinking the localization of our main lesion causing the front problem is here, and she also has some discospondylosis here visible on x-ray. There's also a couple spots here that are suspicious, like C3, 4 it starts. Okay. As far as pain, I've checked for deep pain. For superficial pain, I think it's diminished. I'm gonna try. I have deep pain, but the superficial is diminished. And on this side, there's more feeling here. Yeah, there's ouchie there, okay? But this side's diminished. And then deep pain is present. There, so there is deep pain, all right? And that's going to be it for our neuro exam for right now. And that's her presentation on day 1. Today is 11/29/436, and that's our entry neuro exam for her. So we treated once a week for 3 weeks. She would come in from up north. We treat her for about half an hour, 45 minutes over her affected areas. And here are the results after 3 weeks. This is our girlie, and she's doing the Bob Marley walk. Oh my gosh, she's out of here so fast, I gotta run after her. Here she goes. Meira is out of here. She's totally out of here. She wants out. Out, 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 out. And let's look at you, baby. Good girl. All right. That's great. The use of electromagnetic field therapy for the treatment of Ivdd and other inflammatory conditions are underutilized in vet med and human medicine. Innovarius Nice Therapeutics are raising the bar and improving the standard level of care in the treatment of Ivdd for the benefit of all of our patients. Nice Therapeutics are non-invasive cellular electroceuticals for reduction of inflammation and return of normal function. The medical arts are changing rapidly. If you want to know the secrets of medicine, then think in terms of how energy, frequency, polarity, and vibration affect phase transitions of water in bodies on a nano and on a macro scale. Increased knowledge of phase transitions and their role in biology and how radio frequencies affect them are going to revolutionize medicine. What you saw here means nothing if it can't be reproduced in your animal hospital. Call us and ask us about our research licenses. We have an ongoing pain and neurologic study looking for animals with neurologic symptoms such as loss of function, pain, or anesthesia or loss of proprioception. We're here to serve. Nice Therapeutics. Nice dog.